to.
They
All right.
itch.
They itch, yes. What the itching is more than likely going to be from the fact that you're wearing that surgical bra. Now, you don't have to wear that surgical bra. You're not forced into wearing that. You can wear a regular sports bra if you'd like to, yes.
Okay.
So I went in here. So what I found out in here, what had happened is that, and I was explaining this to your husband, is that what you have there is like when the pectoralis muscle, when it is formed, and in someone like you who works out, is that a lot of times it's not just completely just attached to the muscles right here or attached to the rib cage and the sternum right here. What it does sometimes, it has little finger projections that go backwards.
Okay.
And so I will see those, especially I've seen them like in volleyball players, it'll be the whole muscles will be like attached there. So we had to separate each one of those off the muscle in order to create that pocket. So what I saw though was there was just a couple of spots right there where it was still attached. And so what it is, it caused that dip down on there. So what I did is I just released those, and you can see it smoothed it out completely. It's not there anymore. What you still will probably feel is some of the implant where it's right there. It's still very thin, but otherwise you see the curve is much more there.
Right.
Now it is swollen right here. You'll start to see more of the actual cleavage once the swelling in the sternum has gone down.
Okay.
But I tried to release it all evenly all the way around here to try and make sure all the muscle and everything was just attached correctly there.
Okay.
I didn't see, otherwise, the inflammatory fold, that material that was in there, that seri, that material was doing a great job of holding the inflammatory fold in place, so it's not going to move that much. I did see a slip down. I mentioned to him that he might need to be someone who I like. Normally with textured implants, we do want to stay away from a wired bra or anything that can push it upwards, because we're afraid it might migrate it too high. That's generally when we have a brand new patient that has never had an implant in there before. There was never a pocket there before, because the body has to create and form that pocket. In your case, because the implants were removed, you already have a pocket there. But what I wanted to make sure was that it doesn't slip it down a little bit too much, so we might want to put a little boost. It's right now, everything looks like it's in the right position. What I want to do is when we see you back in a month, and I'll kind of make that decision, because it takes about 3 or 4 months or so for that pocket to really solidify where it's going to be with a textured implant. So we have time to kind of move around, but otherwise everything is in the right position. You'll see the wrinkling around your areola and nipples. Don't worry about that. That actually will go away all on its own. The body will figure that one out. It always will smooth it out over time. Your areolas, I did shrink them down to a very small, but what you will see is that they will widen, slight amount to get back up to a little bit more larger size. The sutures, all absorbable, except for that one I told you about before is permanent inside there. That's our one that we always have to be monitoring to make sure it's okay. For the most part, you should never have a problem with it. But what will happen if it does get contaminated with bacteria, what you will notice is that it's not pus, it's not draining, it's not anything. It'll just be a redness and a soreness in an area. If that's the case, we try antibiotics first to try and get rid of it. If it doesn't, I do have to take out that stitch. The only reason for that stitch is to try and lock the size of your areola to a smaller size, and then it will expand a little bit. You will never feel this thing in about 6 months anyway. But if it does do that, I do have to remove it. If I have to remove it too early, like within like 3 or 4 weeks, there's a chance it will expand it too much, and then we're going to just have to wait till everything heals and then bring it down under revision.